friends. And special guests, we will be starting our ceremony in 5 minutes. Please find a seat at this time. As soon as the music starts, you will need to clear the aisles. For the procession of the graduates, please be advised guests will not be permitted to enter the graduate area during the ceremony. Professional photography is provided at no cost, and photos will be available in June. Thank you. 4 minutes left.
I would ask everyone to please be seated. Good afternoon and bienvenidos. Me llamo Carolina Montoya, and I am the interim dean of the College of Nursing at the University of New Mexico Health Sciences Center, and I couldn't be prouder than to be here this day to share this moment with each and every one of you and your families. We are so proud of all of you. This is a time to recognize the academic achievements of our outstanding graduates, and I am pleased that you are all here to share this today. It is a very momentous day for nursing education because we have our inaugural class of BSN students from Santa Fe Community College who have completed the common statewide nursing curriculum that we refer to as the NEMNEC curriculum. NEMNEC, which stands for the New Mexico Nursing Education Consortium, is a collaborative of every single state-funded nursing program in New Mexico. UNM partners with New Mexico Junior College, Santa Fe Junior College, San Juan Community College, Central New Mexico, and other community colleges to provide BSN education in every part of our state. This extensive and highly coordinated effort is preparing the BSN nursing workforce that will benefit every New Mexican for generations to come. We also have our inaugural class of DNP clinical graduates, as well, of course, as our NEOL graduates, DNP. The clinical DNP are nurse practitioners who have made their decision and put in the hard work to obtain the Doctor of Nursing Practice degree. The DNP is a terminal degree that for clinical focuses on practice. I would like to announce our guests that we have on stage. Joining us is Suzanne Quinlan, UNM Regent, Dr. Che Torres, Vice President for Student Affairs, Dr. Richard Larson, Executive Vice Chancellor for the UNM Health Sciences Center, Dr. Amy Levi, a nursing faculty who is also the Vice Chancellor for Academics for the UNM Health Sciences Center, Dr. Diane Evans-Pryor, Central New Mexico Community College's Director of Nursing, Ms. Jenny Landon, Dean of the School of Sciences, Health, Engineering, and Math at Santa Fe Community College, Ms. Terry Tewart, Santa Fe Community College Director of Nursing Education, Shauna Kemper, San Juan's College's Director of Nursing, Shauna Magnum, San Juan College's Assistant Director of Nursing, and also our College of Nursing Administrative Team, Dr. Judy Leesfeld, Interim Executive Associate Dean, Dr. Mary Jane Lewitt, Practice Team Chair, Ms. Susan Kornkevich, Interim Education Team Chair, Dr. Mark Parshall, Interim Research Team Chair. Also joining me on stage is Ms. Christina Deshay, BSN, very popular because she is a BSN graduate and she is our student speaker. I would also like to recognize the most outstanding College of Nursing faculty in the country. Please stand so we can applaud the work that you do. Just as we have outstanding faculty, we also have outstanding staff. The backbone of any organization is the support of the staff. Joining us today are select staff volunteers and our student services team from the College of Nursing, who you probably encountered on your way in, helping you find your seat, answering questions. Their efforts supporting the faculty and students are invaluable. Would all of the staff please rise, and a round of applause. Wherever you are, they are scattered throughout. So we do have speakers, and I am going to introduce them. First is UNM Regent Suzanne Quinlan. She is a registered nurse as well as a certified nurse practitioner with more than 26 years of experience in healthcare management. She began her nursing career at UNM Hospital, and after obtaining her nurse practitioner's education from the University of Colorado, she returned to UNMH as a nurse educator. Throughout her career, she has served in several leadership positions, including Chief Nursing Officer and Hospital Operating Officer at Lovelace Medical Center, and Director of Patient Care Development and Marketing and Business Development at Mountain View Regional Medical Center in Las Cruces. Please welcome Regent Suzanne Quinlan to the podium to say a few words.
Thank you. Welcome and congratulations to you all. And Dr. Montoya, congratulations to you, and fabulous faculty, congratulations on another class. Nurses, the profession you have chosen ensures you of two things. One, since we are still on track to have demand for approximately 1.1 million more nurses by 2020, you will never look far for a job. Two, you will be lifelong learners, even if those lessons don't come from a lecture or a lab. And New Mexico is ranked the 5th state for the best places for nurses to work. So, go New Mexico. Healthcare is undergoing the largest transformation since the inception of Medicare. Terms like population health, accountable care organizations, value-based care, while still relatively new to us now, will become common vocabulary for you. You are also joining a profession with endless opportunities. From the bedside to the boardroom, your opportunities are abundant. But irrespective of what specialty you select, you will always have one thing in common. You will forever be patient advocates. Nurses are known for always doing what's right. For the past 16 years, the 16th year just came out 3 weeks ago, the public has voted nurses as the most ethical and trusted profession in the Gallup's annual survey. You are our future leaders now, the keepers of that trust. Even though we're the most trusted, we have some challenges. Research indicates that 85% of patient errors could have been prevented if someone had spoken up, most usually the nurse. Florence Nightingale said it best when she said, "Let whoever is in charge keep this simple question in their head. Not how I can always do this right thing, but how can I always provide for this right thing to be done?" We need fresh eyes on our processes. You are our fresh eyes now. When you see or hear something, or your intuition tells you something isn't right, speak up. It will pay off. If you're not working in a culture that supports speaking up, work to change it or move on. You have much more influence right now than you can even imagine. By the way, Congress was voted nearly last on the list in that Gallup poll. Trustworthiness, just saying that. I work for a healthcare company that owns 28 hospitals around the country. RNs hold CEO positions in nearly half of our hospitals. A while back, I asked our company president, "Why do you lean so much towards nurses?" And he said, "You know, there's just something about a nurse that I trust. And when we have a challenge or a dilemma and I get the nurses around the board table, I can always count on the nurses to be the ones that will bring us back around to doing what's right for the patient." I'll end with saying, being a nurse will change you. Caring for patients at the most vulnerable times in their life will change you. It seems appropriate as we celebrate National Nurses Week, as well as Florence Nightingale's birthday, to end with one of her quotes. "Live life while you have it. Life is a splendid gift. There is nothing small about it." Congratulations to you all. Stay in New Mexico and call me if you need a job.
Thank you so much, Regent Quinlan. Next, I would like to introduce to you Dr. Torres, Vice President for Student Affairs at the University of New Mexico and faculty member of the College of Education, where he teaches on the history and folk knowledge of the ancient art of curandissimo, or Mexican folk healing. Before he came to UNM, Dr. Torres served as Vice President for External Affairs at Texas A&M University, Kingsville, where he also taught in the bilingual doctoral program. He has served as interim president, vice president for student affairs and special services, director of the university's Center for Continuing Education, and also as assistant to the president. For 2 years preceding his appointment to the Texas A&M University Kingsville staff, he was with the Texas Education Agency in Austin. Along with other initiatives, Dr. Torres has been involved or been elected as an advisor to Mexican Presidents Vicente Fox and Felipe Calderon for improving lives of immigrants in the United States. Please welcome Dr. Torres to the podium to say a few words.
Good afternoon, graduates, and congratulations. As I look at the audience, I see a lot of you very proud and thankful. Proud because you're graduating from a first-rate university, a level 1 Carnegie Very High Research University founded in 1889, and that's important. Age is important in well-known universities, and this university has been around many, many years. In fact, you have the golden graduates here, or some golden graduates that graduated from the College of Nursing 50 years ago, so welcome, golden graduates. Yes. And you're thankful. You're thankful that you have family members here that have been supporting you all these years, that love you and want you to succeed, and you will. You have faculty members. Some of the best faculty in the country have been your instructors. Faculty that have published, that have researched, and have shared with you their knowledge and wisdom. There's no doubt in my mind that you will do well in the nursing profession. I grew up in a mom and pop pharmacy around many physicians and nurses, and a lot of my relatives are nurses, and I learned to love and appreciate your profession. You certainly know how to offer TLC, tender loving care, to your patients, and that's part of healing. I've studied traditional medicine, even laugh therapy, where laughter is healing, and you're able to do that with your patients. So again, congratulations to you, to your family, and best of luck. Saludos a todos. Gracias.
Thank you, Dr. Torres. Finally, I would like to introduce to you our student speaker, Christina Deshays. Ms. Deshays is graduating with a Bachelor's of Science in Nursing degree and has been selected as the graduate speaker for today's convocation.
Welcome, everybody. Can you guys believe this is actually happening? We did it. I am honored and so very thankful to represent this amazing group of people that sits before you. You guys are all amazing human beings. I have learned so much from each of you, and I am so proud to stand here with you today and graduate. What a wild ride this has been. The best way I can think of to describe it is with a nursing diagnosis. Stress overload related to sleep deprivation, social isolation, and unbalanced nutrition, as evidenced by being a UNM nursing student. We have all sacrificed an incredible amount and overcome incredible obstacles to get here. Each of us has a story from before nursing school that will shape our nursing practice and give us a unique contribution to nursing. Then there's nursing school itself. We endured long clinical shifts, papers, due dates, tests, the list goes on. Before nursing school, I had no idea how difficult a multiple choice test could really be. We missed family events and friends wondered where we had disappeared. We also tapped into another part of ourselves, a strength we maybe didn't know we had. Our scope of practice grew, and so did we. We grew closer as friends and as peers. We remained a team. I told myself I wouldn't cry. And through our teamwork, we gained individual strength. We supported each other, and we became a nursing family. When you go through something difficult, you emerge out the other side stronger. We have emerged stronger, better, more multifaceted. Not only have we emerged as better nurses, we have emerged as better people. This period of trial has become a time of incredible growth, brought on by hard work, faith, tenacity, grace, and perseverance. Each and every one of you should take pride in your accomplishment. No person is an island. We are never alone. There are so many people to thank. First, I want to thank the incredible faculty members who have been with us along the way. Thank you for sharing your knowledge and for being our mentors. Thank you for caring about your students. Thanks for letting us usually argue the questions, even if you didn't give us the credit. Thanks for answering the occasional 11 p.m. email the night before a test. Thank you especially for pushing us to do better and to be better. To our friends and family, our support systems, thank you. Each and every one of you has made a difference in us being here today. Thank you for being there for us even when you didn't understand why we were melting down or panicking. Thank you for your sacrifice, and thank you for your support. You are incredible, and we love you. I also know that the family members who have gone before us and cannot be with us today are watching over us and are very proud. You have made them proud. What an amazing career we have chosen. Nurses are awesome. We're also sometimes a bit different. We place great value on things that non-nurses maybe find awkward. Passing gas is actually really important. We've developed a slightly warped sense of humor from the crazy things we've seen. But what an impact nurses have, and the impact that we will have for our patients and their families go far beyond starting an IV, inserting a Foley catheter, giving discharge instructions, giving diagnoses, prescribing medications for our advanced practice RNs in the room. These things are very important, of course, but it pales in comparison to what we are. We are trusted professionals and a source of strength for our patients. We are involved with patients in a very sacred space, in their most vulnerable moments. It's a privilege of the highest order. The American Association of Critical Care Nurses described the role of the nurse with the phrase, "Nurses ensure safe passage." This we do. We shepherd patients through illness and through treatments. We ensure safe passage from triage in the ED to a hospital admission. We see clients and their babies through pregnancy and childbirth. We watch over the wellness of the public. We are with families going through the best and worst days of their lives. Nursing is a calling and a greater purpose. Let us move forward in spite of any fear that we may have. And I'm not talking about the healthy fear that keeps our patients safe. That fear is good. I'm talking about the fear that will tell you lies, the fear that tells you you're not good enough and that you can't do it. You can do it, and you were made for this. Let us move forward in your new roles with the same devotion, faith, and tenacity that got us through school. Let us be a source of care, comfort, and knowledge. But first, let's celebrate, because we did it. Congratulations, class of 2018.
Thank you so very much. That was lovely, Christina. So, we're not quite done with speeches because guess what? I get the final word. And so I'm going to use that this time to tell you a bit of a story. So, I know that Convocation is one of the most memorable occasions in a person's life. It is a time of great joy, pride, and to a great extent, relief. No more papers, no more quizzes, no more tests, except for that pesky little NCLEX and the certification for advanced practice. So, given that this speech is all that stands before you in the main event, which is recognizing you as graduates, I see two major challenges before me. Provide you with some words of wisdom that leave a lasting impression that will carry you through your entire nursing career. But there's no pressure there. Make it quick, because you want to get to the best part of the ceremony, which is your recognition. I do indeed want to have this speech to have some meaning for you, so I'm going to discuss something that should be very familiar to all of you from your nursing curriculum, whether you were BSN, master's, or doctorally prepared. That is a concept analysis. Oh, because you were in a concept-based curriculum. And so the concept that I want to talk about is the concept of caring. And how did I know what is most associated with caring in nursing? Well, I did what any self-respecting academic professor would do. I Googled it. The Google definition of a nurse is a person trained to care for the sick or infirm, especially in the hospital. Google needs a tutorial. Not satisfied with that source, I went to even a more reputable source. I went to Wikipedia, where I found the following definition. Nursing is a profession within the healthcare sector focused on the care of individuals, families, and communities so they may attain, maintain, or recover optimal health and quality of life. That's a little better, isn't it? So I decided I would query the ultimate source. I asked Alexa, Alexa, what's the definition of a nurse? Someone who cares for the sick or handicapped. While all of these definitions of nursing contain the word care, what does this really mean? We get various definitions from a dictionary, but lest you think that I only use popular search engines for research, let me assure you that I do due diligence by going to the literature. Dr. Jean Watson, in her work on establishing a theory of human caring, states preserving human dignity, relationships, and integrity through human caring are ultimately the measure by which patients evaluate their often cure-dominated experiences. Dr. Bauer discussed caring as the central focus for nursing curricula. She recommended that a caring framework utilizing a holistic approach to understanding people as human beings of value, work, and having needs should be the focus of the content. But as Regent Quinlan referenced, the ideal in terms of the caring really goes back to Florence Nightingale. We are in Nurses Week. We do celebrate her birthday on May 12th. She was the original nurse researcher, educator, and clinician. She reduced the death rate of British Army soldiers in the Crimean War. She improved population health with her book, Notes on Nursing, What It Is and What It Is Not. And she established the first 3-year independent training program for nurses in London. She noted that health and the curing of disease was not solely dependent on medication and treatments, but also included effects of noise, lighting, food, cleanliness, and the care provided for the ill. As you know, every concept that we teach involves an exemplar. I am the case example for what care in nursing means. In March of 2017, my husband, Victor, was visiting my military son and his family in Germany when he became dramatically ill and required immediate hospitalization. I left immediately to Germany, but you don't get to Germany in 2 hours. Truly, I did not know what I would find when I got there, if he would even be alive. However, we were very fortunate that he got excellent care, and he did survive. However, he had a diagnosis of liver failure with no etiology. This previously healthy man on absolutely 0 medications, no serious illnesses, played sports all his life, now had a chronic disease. He spent 5 days in intensive care and 6 days on a general unit in a German hospital before I was able to get him back to the US. Now, as a side note, I want you to think, how much would that cost in the US? Hundreds of thousands of dollars. The total cost in Germany for 6 general unit days and 5 days in ICU, $5,000. Fast forward to March of this year, he became critically ill, requiring hospitalization at UNM Hospital, and ultimately being air ambulanced out to Baylor Hospital in Texas for a liver transplant. We were very fortunate. He was one of the lucky ones, and he got a liver on March 20th. So that's his new birthday. This is my experience of caring. The physicians saved my husband's life. The nurses made sure he had a life worth living. Victor was in intensive care unit immediately after receiving his new liver. He had, at a minimum that I counted, 4 intravenous lines, at least 7, 8 bags of fluids and blood running. He had multiple tubes in other parts of his body that I will not describe to you. And there was one nurse who was managing him. In addition to managing every single line, watching all of his vital signs, adjusting medications based on what was going on, she was making sure that my son and I knew what was going on, and she was providing the relief that my husband needed in terms of pain. To the point that my oldest son, Alejandro, my dear sweet Alejandro, says to me later, "I have a whole new respect for nurses. I had no idea what they do." And I looked at him. Am I chopped liver? I mean, I've been a nurse for over 30 years, and now he really understood. And you know what he focused on? He focused on the fact that this nurse had so much to monitor, but he focused on the care, the gentle care that she gave to his father. Throughout the entire experience, the nurses provided the care. And by care, I mean they preserved his dignity in the way they handled his basic human needs. They honored his family relationships by allowing us to be at his side, and they saw to it that we understood what was going on. I'm a peds nurse. I don't know all those meds. I will tell you I have a whole new respect for the adult gero acute care NPs in the audience, because they were my best buddies. Sometimes the docs didn't quite tell us what was going on, but I'll tell you, those AGA CMPs let me know everything that was going on. While I will be forever grateful for the excellent medical care he received, and I do mean it was excellent, I will never forget, nor will my family, the care provided by the nurses to all of us. Your education at the College of Nursing has provided you with the knowledge you need to be excellent nurses, and it is my expectation that we have infused in your very being, your soul, the concept of caring. Because when all is said and done, what really matters to your patients and their families who are at their most vulnerable is providing nursing care based on the fact that they are a human being, and each and every human being is entitled to care delivered with dignity and respect. It is what Florence Nightingale stood for, it is what she is remembered most for, and it is what truly stands out for nursing, and it is what you will be most remembered for. May all be well with you. Que les vaya bien, and congratulations. I'm going to ask Dr. Liebsfeld to come to the podium.
Good afternoon. Every year, the College of Nursing faculty nominate and vote on student convocation awards to honor our outstanding graduates. Students, as your name is called, please stand. Audience, please hold your applause until all recipients have been named. Recipients of the Spring 2018 awards are Nursing Leadership Award, Christina Deshays. Pre-Licensure Academic Achievement Award, Rachel Saladin. RN to BSN Academic Achievement Award, Sochi Ibarra. Outstanding NEMNEC Dual Degree Award, Jordan Gonzalez, Central New Mexico Community College. Robin Armel Memorial Award, Roberto Ramirez. Sigma Theta Tau Outstanding Undergraduate Student, Rachel Salandon. Graduate Academic Achievement Award, Melissa Scott. Sigma Theta Tau Outstanding Graduate Student, Doris Tinajero. Estelle Rosenblum Thesis Dissertation Award, Regina Eddy. Please join me in giving them a big round of applause. Next are the Faculty Awards. Perhaps the most coveted award among faculty is being recognized for excellence in teaching by the graduates. For this award, faculty members are nominated and voted on by the graduating students. Outstanding undergraduate faculty is Mr. Jason Barron. Mr. Barron moved to New Mexico in 2014 to join the faculty and enjoy the sunshine. His clinical specialty area is adult intensive care, and his teaching interests include bridging conceptual and clinical learning and the integration of technology into the classroom. Mr. Barron is known to be a devoted student advocate. Congratulations, Jason. Our outstanding graduate faculty is Dr. Christy Kogel. Dr. Kogel is a graduate of the UNM FNP program. She precepted UNM nurse practitioner students and discovered her passion for education. When an opportunity arose to return to UNM as a faculty member in 2010, she jumped at the chance. Her clinical specialty is family practice, and her teaching interests include integration of oral risk assessment, examination, and management into primary care practice. Dr. Kogel is known for her mentorship and help in transitioning students to advanced practice nursing. Congratulations, Dr. Kogel. We are now at the exciting point in the ceremony you have all been waiting for, the recognition of our graduates. First, we will be recognizing a very special group of graduates, what we refer to as our golden grads. The College of Nursing was originally started by Dr. Marion Fleck and Mary Jane Carter in 1955 with the enthusiastic support of UNM President Tom Popejoy and a state budget of $60,000. Eleanor King was selected as the first dean. The College of Nursing is extremely proud to be honoring our golden anniversary graduates today. We welcome the class of 1968 to our spring convocation. These graduates may be wondering, where have all those 50 years gone? At this time, we would like to take a few moments to also remember those members of the 1968 graduating class who are no longer with us. We've listed their names in our program and have honored them by placing a rose on stage for each graduate who has passed away. Our golden graduates will be pinned by Dr. Carolyn Montoya to honor them on this special day. This pin recognizes their status as College of Nursing Golden Anniversary graduates. Maxine Eleanor Vigil Russell. Barbara Earsom Fowler. We will be honoring our BSN graduates, so I would like to call Dr. Evans Pryor, Ms. Jenny Landon, Ms. Terry Tewart, and Susan Kornkevich to the center of the stage with Dean Montoya. Each graduate will be pinned with the College of Nursing pin and will receive a small welcoming gift from the College of Nursing's alumni community, presented to them by our Director of Alumni Relations, Marlena Bermel. This is a prestigious community that our students have worked hard to become part of. Amber Tabor. Sonova Luth Sanchez. Kristen Ileskis. Melanie Yazzie. Stacy Pitts. Barbara Chavez. Jacqueline Suru. Rachel Valerio. Victoria Eva Maria Armijo. Jordan Gonzalez. Julie Smith. Amy Chavez. Jennifer Wilson. James Bastian. Sarah Hands. Lana Leung. Amelia Maldonado. Ryan Della Paz. Aaron Bruner. Whitney Hilton. Courtney Wolf. Rachel Grady. Cassidy Hansen. Rachel Saladin. Erica Duran. Abby Bradley. Johanna Bencomo. Elizabeth Wheeler. Justin Hinkle. Samuel Peters. Alyssa Peters. Catherine English. Adina Noel. Claire Merritt. Noel Likovic. Autumn Romero. Rebecca Skinner. Chelsea Schaefer. Stephanie Finley. Kristen Galbraith. Candace Markey. Rachel Joyce. Christina Baca. Cheryl Haskin. Corey Salas. Crystal Archuleta. Amanda Baca. Christiana Benisevich. Kristen Trujillo. Stephanie Bernie-Claw. Andrea Sanchez. Madison Hatfield. Winter Bateman. Francisco Espinoza. Christina Deshays. Mimi Vong. Melissa Amaya. Marissa Trujillo. Paulina Alcocer. Jocelyn Mayo. Brianda Patino. Kayles Sanchez. Maudie Malden. Sarah Gonzalez. Dawn Nguyen. Marie Olson. Alexandra Jurek. Kylie Pepe. Michaela Myers. Nissa Felton. Fernando Asensio. Leanne Dubik. Rebecca Schmidt. Nicole Eaton. Preston Hill. Roberto Ramirez. Chandra Henry. Sakiba Wame. Donslin Worthington. Dominique Dexter. Ade Torres. Nicole Hall. Daniela Martinez. Kylie Hood. Jadzia Jetty. Grisel Garcia. Daniel Beckwith. Cynthia Gonzalez. Sarah Flory. Ursula Kirkpatrick. Allison Yates. Allison Monson. Mariah Lucero Barner. Our next group of graduates is also from our undergraduate baccalaureate nursing program. They are registered nurses who previously completed an associate degree or diploma in nursing and were motivated to return to school to earn their Bachelor of Science in Nursing degree. Cheryl Pollock. Victoria Lovato. Trisha Poncho. Ashley Crownover. Michaela Holler. Nicole Gonzalez. Robin Acothley. Jennifer Ortega. Amberly Moorish. Kristen Sanchez. Trinity Abernathy. Sochi Ibarra. Monique Summers. Hannah Ayesh. April Dunn. Caitlin Martin. Karen Escalante. Michelle Berger. Christy Martin. Jara Jones. Ashley Azua. Monica Castellano. Jenny Montano. Did you go by Jorge? Okay. Jorge Brenna. And at this point, I would like to invite Dr. Woods and Dr. Lewitt to the stage. We next recognize our graduates from our Master of Science in Nursing, MSN degree. The College of Nursing offers 5 concentrations in the master's program. You will notice the MSN graduates will be wearing hoods, the ceremonial designation of a master's degree. The apricot color on the front of the hood represents nursing. The red and silver colors on the back of the hood are the University of New Mexico colors. Richard Lujan. Saiyao Hua. Anne Reines. Amber Jackson. Elizabeth Jaffa. Robert Fromater. Michelle Hanna. Taylor Bailey. Jason Rotunda. Anita Nelson. Lisa Hendel. April Lopez. Derek George Sandoval. Jacqueline Fernandez Quesada. Nadia Caño Vasquez. Erica Abeta Chavez. Nadine Baldonado. Paula Cordova. Catherine Gerber. Patricia Aldaz. Rebecca Casalino. Catherine Callan. Lindsay Young. Ian Hamilton. Rachel Schaffner. Mary Percule. Krista Lee. Jamie Boykin. Melissa Scott. Sada Johnson. Hannah Morgan. We next recognize graduates from our Doctor of Nursing Practice DNP program degree. The College of Nursing offers 2 concentrations in the DNP program, the DNP for nurse executives, as well as the DNP clinical concentrations. These graduates will be hooded with the professional doctorate hood, a longer and more elaborate hood with an apricot-colored panel, signifying that their professional doctorate is in nursing. Following academic tradition, DNP graduates will be hooded by their scholarly project chair. I will not only be saying the name, but also the project that they completed for their DNP scholarly project. Ryan Harris, Sexual Orientation and Gender Identity Data Collection, Attitudes, Beliefs, and Perceived Barriers among Inpatient Registered Nurses and Medical Providers on Progressive Care Units, with distinction. Hooded by Dr. Jeff Schuster. Torres, measuring healthcare providers' perceived age of transition and transfer for youth with special healthcare needs, with distinction, hooded by Dr. Carolyn Montoya. Nancy Cole, will utilizing the BOOST tool improve post-acute transition and decrease unnecessary hospital readmissions in total joint replacement patients, with distinction, hooded by Dr. P.J. Woods. Monica Vickery, efficacy of post-discharge interventions on preventing hospital readmissions in stroke patients, hooded by Dr. Therese Hidalgo. Brenda Hawley, provider perception and use of prepare patient for discharge order in adult cardiac and adult medical progressive care units, hooded by Dr. Kim McKinley. Jacqueline Woolner, the costs and benefits of outsourcing marketing, student recruitment, and retention services in an undergraduate RN to BSN nursing program, with distinction, hooded by Dr. P.J. Woods. Jackie is one of our beloved faculty members. That's why we're all standing and clapping for her. We're really proud of her. Melissa Cole, how do nurse leaders assess their practice of ethical decision-making before and after ethical leadership training, with distinction, hooded by Dr. Christine DeLucas. Annabelle Gerhardt, using safety checklists outside of the operating room, hooded by Dr. Judy Liesfeld. Kathleen Davis, identify the qualifications, major duties, responsibilities, and expected outcomes for the Chief Experience Officer among healthcare systems in the United States, hooded by Dr. P.J. Woods. George Dresden, determining the feasibility of a structured inpatient pulmonary rehabilitation program for patients with interstitial lung disease, hooded by Dr. Sharon Schaff. Louise Crozier, celiac disease, enhancing educational support for gastroenterology providers in the adult celiac population, with distinction, hooded by Dr. Joanne Hafley. Erin Skiles, expanding access to hepatitis C treatment through an APRN-managed primary care clinic in a rural hospital setting, with distinction, hooded by Dr. Van Roper. The final graduates we recognize this afternoon are those who have earned the Doctor of Philosophy degree with a major in nursing. They will be hooded with the PhD doctorate hood, a longer and more elaborate hood with a dark blue panel signifying the PhD degree. Following academic tradition, PhD graduates will be hooded by their dissertation chair. Regina Eddy. A socio-ecological analysis of childhood obesity and school nutrition policies and practices in select elementary and middle schools on the Navajo Reservation. Hooded by Dr. Kim Cox. Elizabeth Dixon. Sexual health education in New Mexico public secondary schools. Hooded by Dr. Mark Parshall.
As you can imagine, the profession of nursing is steeped in years of tradition and rites of passage. One of these includes the nurse's oath, where we pledge to embody all that it is to be a nurse. You can find the nursing oath on the inside cover of your program. We invite all nurses with us here today to recite the oath with our graduates. Please stand. As a nurse, dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns, act in a compassionate and trustworthy manner in all aspects of my care, apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients, exercise sound professional judgment while abiding by legal and ethical requirements, accept the lifelong obligation to improve my professional knowledge and competence, promote, advocate for, and strive to protect the health, safety, and rights of this patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public. You may be seated. Graduates, on behalf of the faculty and the staff of the College of Nursing, please accept our sincere congratulations and felicidades. Know that you are now among the ranks of many UNM College of Nursing alumni who have made a difference in the healthcare and the lives of New Mexicans. We know that you will do the same. We wish you the best of luck as you begin in your career or the next chapter of your careers. Please keep in touch with the college as you move throughout your career and your life. Without you, our work at the college is futile. You are our most valuable asset. Let's have a round of applause for all of our graduates. Graduates, please stand. All right. So I'm going to ask I'm going to ask the audience to sit down for a moment. Just the audience, the graduates, please stay standing. Audience, sit down. Because one of the things that we always like to do is that we are very, very much aware that completing an undergraduate or graduate degree in nursing requires the sustained commitment and focus of the graduate. I would like the graduates to turn and face the audience, because I would like all of us to acknowledge the following individuals. First, we would like to recognize the parents of our graduates. Please stand. Next, let's have the husband, wives, partners, and children. Please stand. And finally, will the grandparents, grandchildren, siblings, aunts, uncles, and all others who are special stand. This concludes our 2018 College of Nursing Health Sciences Center UNM Convocation. Please remain seated until all faculty and graduates have exited. Thank you very much.